Mustiola, your learning hub on TV for Davao de Oro. I am teacher Mustiola Vista from Nabunturan National Comprehensive High School, Nabunturan West District. Today, we will be talking about Health 7, Module 4, Lesson 1, focusing health appraisal and screening procedures. But before that, get your module in health, notebook and pen, so you can take down notes. From your previous lessons in Health 7, you learned about the different coping skills. Now, we will recap some of the important tips about the different coping skills. I want you to identify the following statements, whether support-seeking strategies, positive problem-solving strategies, positive reframing strategies. Are you now ready? So let's start. Number 1. Take a deep breath. Did I hear positive reframing strategies? Yes, you are correct. Number 2. Look at the problem as a challenge. Check. It's positive problem-solving strategies. Number 3. Seek advice from responsible family members or relatives. You got it right. It is support-seeking strategies. Number 4. Talk to a friend who can do something about your problem. Awesome! It's support-seeking strategies. Number 5. Believe that you can do it. Yes, that should be the spirit. Positive reframing strategies. Great job, grade 7 learners! Today's lesson will help you understand the importance of health appraisal and screening procedures. Do you believe that prevention is better than cure? Astounding yes! Health appraisal and screening procedures are one of those preventions we need to know. Health appraisal are a series of procedures to assess or determine the health status of a learner. Screening for blood pressure is added to the routine test for height, weight, vision, and hearing. Immunizations are also updated. Remember, you need to be open-minded and free from malicious or bad thoughts as we go along in this topic, for you to be able to fully understand the importance of health appraisal. As part of the health appraisal, it is recommended for girls to check your breasts for possible masses or lumps the moment you start menstruating. You should do this monthly, specifically 1 week after the onset of menstruation. This time, I will show you a video on how to examine breast. Let's watch this.
Breast cancer is the most common cancer affecting women in Singapore. It is estimated that 1 in 14 women before the age of 75 will develop breast cancer in her lifetime. You can keep a lookout for breast abnormalities, starting with a visual examination of your breast with your arms by your side in a neutral position in front of a mirror. Look for any of the following: changes in the shape and size of one breast, dimpling or puckering of the breast skin or nipple, persistent rash or change in the skin around the nipple, nipple inversion, retraction, bleeding or unusual discharge, skin redness or soreness of the breast, accentuated veins of the surface of the breast, unusual swelling of one upper arm. Adopt the following 2 positions. Raise your arms above or behind your head. Press your hands on your hips and tense your chest muscles. These 2 positions allow for a closer inspection of the following: changes in the shape and size of one breast, dimpling or puckering of the breast skin or nipple. To feel for changes in your breast, underarm, and collarbone areas more accurately, do so by lying down because the breast tissue spreads out evenly across your body. This makes it easier to feel for lumps. What you should look out for: a lump, swelling, or thickening in the breast or underarm area, any enlarged lymph nodes at the underarm and above the collarbones. Lying down. How to examine your breasts when lying down. Elevate your right shoulder by placing a folded towel or pillow underneath. Extend your right elbow outwards and place your right hand under your head. Use the pads of your 3 middle fingers and apply pressure to feel your breast tissue in a circular motion. Use 3 varying pressure levels, light, medium, and firm, to feel for all the breast tissue from the skin level to tissues closest to the muscles and ribs before moving on to the next area. Examine the whole breast systematically in a clockwise or anti-clockwise direction. Press down over your nipple with 3 varying pressure levels in a circular motion. To check for lumps at your underarm area, put your arms by your side. Start in the hollow of your underarm and move towards your breast, making overlapping small circular motion. To check above the collarbone, use light pressure and move in a circular motion. Repeat the same steps on your left side. How often should you perform breast self-examination? The best time to perform a self-examination is about a week after the start of your menstruation. It is more effective to perform on the same day of each month if you are no longer menstruating, pregnant, breastfeeding, or have breast implants. It is important to understand that breast self-examination can complement breast cancer screening, but it is not a substitute for it. Most lumps or changes in the breast are not cancerous, but as a precaution, it is advisable to consult a doctor as soon as possible.
How did you find the video? Is it helpful and beneficial? I hope you understand and comprehend the steps on how to do it. Please inform your parents about these healthy tips. Moreover, scoliosis is a condition in which the spine curves to the side. It is an abnormal lateral or side-to-side curvature of the spine. Take a look at the pictures. Have you seen the difference? So, if you can notice this from your body or from your family and friends, you have to refer it immediately to a physician for further medical attention. To visualize more about signs and symptoms of scoliosis, Here's a video courtesy from OAC Orthopedics. Let's watch this.
Scoliosis is an abnormal curvature of the spine that, if left untreated, can lead to medical complications. In order to understand scoliosis better, let's first take a look at a healthy spine. Small bones called vertebrae align in a series to compose the spine. Ligaments and muscles connected to the spine provide stability while allowing movement. A healthy spine has natural front-to-back curves. The curve in the neck area is called the cervical spine. The second curve forms the thoracic spine, located in the upper back. And the third curve forms the lumbar spine, located in the lower back. A healthy spine appears straight from a front or back view. Scoliosis causes an abnormal side-to-side curve of the spine. This affects the structure and posture of the rest of the body. One hip or one shoulder may appear higher than the other. The shoulder blades may stick out, and the body may lean to one side. Scoliosis is a progressive condition, meaning that it can get worse over time. If left untreated, a severe curvature can form, causing the vertebrae to rotate and move even further out of position. This can make it difficult to breathe, or cause pressure on the spinal cord and nerves, causing pain and fatigue. So what causes scoliosis? Some people are born with malformed vertebrae, unequal leg lengths, or fused ribs that cause congenital, meaning born with, scoliosis. Neuromuscular conditions such as cerebral palsy, muscular dystrophy, spina bifida, and polio can also lead to scoliosis. In adults, scoliosis may develop because of degenerative changes in the spine, including osteoporosis, a bone-weakening disease, and arthritis. In most cases, the cause of scoliosis is unknown, and this is termed idiopathic scoliosis. Mild spine curvature usually do not require treatment, but are monitored. Back bracing may be used to treat curvatures that are more significant for children that are still growing. Back braces use pressure to strengthen the spine. Physical therapy can help to strengthen the back and improve balance while sitting, standing, and walking. Occupational therapy can help improve independence with daily activities, such as dressing. Therapists can custom order seating systems that provide support and help maintain posture. Surgery is usually required for spine curvature that are significant because of the high risk of medical complications. Spinal fusion surgery is used to correct the curve in the spine and secure the vertebrae together. Children are screened for scoliosis in most school systems, and adults are screened for osteoporosis as they age. Regular monitoring and intervention may help scoliosis from becoming worse and allow the greatest amount of independent activity.
Based on the video, this condition commonly develops during sudden brief of the growth of adolescence. It affects girls more often. This condition can be corrected if treated early, before the bones have fully developed. Signs of scoliosis. 1. One of the shoulder blades is more prominent. 2. The head is not aligned to the center of the pelvis. 3. A hip appears higher or is more prominent than the other. 4. The rib cage is uneven. 5. The waist is uneven. the entire body is leaning to one side. Holistic health can be achieved by practicing good health habits and submitting to screening tests. What are those screening tests? Number 1, mental health examination. Keeps you informed about your general health status. Number 2, dental examination. Keeps you informed about of any dental problems. Number 3, height taking. Gives you an idea about your growth rate. Number 4, weight taking. Keeps you aware if you are within your ideal weight. Number 5, vision test. Keeps you informed of your visual acuity. Number 6, scoliosis test. Keeps you informed of any abnormal curvature of your spine. Number 7, breast self-examination. Keeps you checked unusual lumps. Number 8, hearing test. Keeps you checked the ability to hear the loudness and pitch of the sound. How are you? Did you understand the health appraisal and screening procedures? Very good! I have here pictures of the different screening tests. Identify each picture to what screening test it belongs. Picture number 1. Very good! Taking weight. Picture number 2. You got it! It's taking height. Picture number 3. Brilliant! It's self-breast examination. Picture number 4. You're right! Scoliosis. Picture number 5. Awesome! A hearing test. Picture number 6. Excellent! It is a vision test. Great job, students! You were able to answer all the questions which were rounded up for you. I know you fully understand how important health appraisal and screening procedures are. I would be glad if you can do your task at home. Answer Module 4, Activity 3, I do it for you, on page 12. Truly, I am amazed in taking your time and jotting notes in our topic. Thank you so much for watching and listening. Once again, I am Teacher Mustiola Vista of Nabunturan National Comprehensive High School saying, dito sa TV Eskwela, sa pag-aaral, sama-sama. Bye-bye!